Hi, everybody. Welcome to the conversation with Dr. Jay Harness. I'm your host, Jay Harness, and it's a treat to be with you today. And I'm particularly thrilled to have a good friend of mine, Matt Peale, join me today for a wonderful conversation. Matt is the author of The Athlete in the Game of Life, an interesting title for a book, Matt. And he's also the host of the Peale podcast, which is a mouthful. And he's been a professional health fitness expert since 2008. Matt is a graduate of the University of Southern Mississippi with a degree in marketing. He's also a sports performance coach, a corrective exercise specialist, which I'm interested in hearing about, a stretching and flexibility coach, and all these wonderful certificates are through the National Academy of Sports Medicine. I've gotten to know Matt through the Maple Tree Cancer Alliance, where he's now certified to work with cancer patients. So let me take this opportunity to welcome my good friend, Matt Peale.
Thank you, Jay. How are you today?
Hey, I'm doing great, Matt. So why don't let's start off by you starting to tell everybody about your backstory and your interest in sports and all the fantastic things you're involved with.
Yeah, thank you. Yeah, so I got into fitness in 2008, really as a second career. Uh, as you talked about, I have a marketing degree, and do I still use it every single day? Because what do? I sell fitness services. I sell training services, so it's still relevant to what I do. But I'm not selling a product anymore, or a pen, or whatever it may be. So I've been in the industry, started out in California and worked my way through, moved to Mississippi, and now I'm down here in Mandeville, Louisiana. Along the way, I've worked with everyone literally from 8 to 80. Phrase goes blind, crippled, and crazy. So I've worked with a ton of different clients, and just got into the exercise oncology, like you talked about, through Maple Tree Cancer Alliance back, was it just after COVID? I think it was
Yeah, I
in
think it was,
21,
Matt.
maybe something like that.
That sounds about right to me. You bet.
22, and that started as a result of working with a client named Steve Mixon, who I still work with, and he came to me at a health club here in Mandeville called Franco's Athletic Club to work on getting stronger for his rectal cancer surgery. He went through chemo and radiation beforehand,
Yeah.
and the doctors told him, we're going to go through surgery. We suggest that you go through about 8 weeks of strengthening to get ready for your surgery so you can pass through it in more flying colors, and then go on from there. It wasn't a deathly diagnosis. If they left it uncaught, or untreated, I should say, then it would have been. But he did well, went through with flying colors. Actually had to go up some stairs right after his treatment. He said, if I didn't work out with you and get stronger, there was no way I was going to be able to just walk up the stairs in the hospital, because it was kind of a snafu with train going from, I think, the operating room back to his room or what have you. And here you are, right? It's go time. Since
Yeah.
you
Yeah.
got life starting immediately, so you better be strong enough to get there.
So, Matt, what you're describing is called prehab or prehabilitation. In my world of breast cancer, that's really important because with some types of breast cancer, patients actually, as their very first treatment, undergo chemotherapy. And
Hmm.
so you can use exercise and exercise oncology techniques to get them ready for that. Rectal cancer is another good example. Men who are going to undergo prostate cancer surgery with robotic surgery, getting them ready. Patients who need bone marrow transplants. So the prehab concept that you talked about was really important. What did you include in your prehab approach with him?
He was a former junior college basketball player, so he was an athlete already, and understood how to work out. It just had been a long time since doing so. So when Steve went through treatment, Steve is 55 now. He was right around 50 years old. Um, I guess maybe 52 or so. But it's been a while since he worked out. So it was with basically flexibility, mobility exercises at first, and then strength exercises. And look, we're talking, yeah, bench press, squat, shoulder press, pretty much kind of lifting 101, but it wasn't necessarily about trying to put a lot of size and mass on him. Let's just get stronger to get through them and work through some of your muscle imbalances. And
Sure.
so that's what we did. And Steve's what, 6'2"? No more than 6'3", about 6'2". Currently he weighs, I think, around 205.
Okay.
And I'll tell you this, man. Years later after it, at 6'2", 205, the guy is bench pressing 275 pounds. I mean, he's just has redneck strength naturally, and he'll tell you that because he's from Van Cleve, Mississippi. But on top of that, he's just really blossomed, and you would not even know he went through cancer at all just by looking
Yeah,
at him.
so you bring up a really another critical point here. And for our audience, you and I were chit-chatting before we started recording, and I want to remind our audience that when it comes to exercise for cancer patients, we just talked about prehab. In other words, as soon as the diagnosis is made, then there's the component that will typically be in medical centers, which is during active treatment, particularly chemotherapy. But here's the really important component of exercise for cancer, and that's out in your industry, in the fitness industry. We have to think of most cancers as a lifetime journey, don't we? And we know that we
Correct.
can have recurrences down the road for even 3 years, 5 years, 10 years. In my world of breast cancer, 15 years or more. So that lifelong journey component of this is really important out in your industry. And so it sounds like he's continued on exercising regularly post diagnosis and what have you, correct?
Oh yes, he's doing fine. I see him twice a week, um, religiously. He doesn't miss, and it's not just from a physical standpoint. It's also emotional and mental and stress for him going through. Plus, a lot of us in the fitness industry, which is kind of like being a hairdresser. We get all the gossip and we get, we get everything
All
that's going on in the family, and it's their chance to vent and
right,
just
all
kind of
right.
be away. So it's
No, but
important.
you brought up another really important thing, and that is bonding with your trainer.
Yes.
Or if you're in a group exercise for cancer patients, bonding with the group and trainer. We've got a lot of data on that about how important that really is. You see, in a casual conversation you and I are having, you've already hit three really critical components of what exercise should be all about for cancer patients. What about any other particular experiences you want to point out to us with somebody?
Yeah, I'm working with some other cancer patients too. Working with a gentleman who is 73. Uh, I got to do a virtual half-hour session with them, but he's prostate,
Yep.
and he went through prostate cancer, and I was worked with him while he was going through treatment, and he was,
There you
obliterated on the days he went through treatment. So he would go to Baton Rouge and then come back, and we would still do some type of just basic body weight exercises, rotator cuff, stretching, flexibility,
go. Yep.
just to keep him moving.
Yep.
And he was a former ER doctor, by the way.
Okay. Now, what about the aerobic component? You obviously are quite fixed on muscle mass, which, by the way, we also know that muscles, when they're activated, put out things called myokines. And we know that myokines can have an anti-cancer effect. We also know the immune system cuts in. And as the immune system starts firing away with exercise, it's releasing killer lymphocytes and things of that sort. So these are all the real benefits of exercise for cancer patients. Matt, given how important your industry is, do you have any ideas of how we could create more interest out in your industry?
I think it's getting people like Steve and then Dr. Lloyd Geringer, who I just talked about. And then I treated another lady as she was going through rehab for breast cancer and double mastectomy. And then now even other 77-year-old, no, she's 78, Judy, who's had kidney and had breast cancer and rheumatoid arthritis and is exercising, getting these people to come out and give testimonials and share their experience, why it's so important, why it's changed their life through their treatment. And now they're way beyond the road to recovery. They're beyond recovery. And it was just kind of a bump in the road in a sense in the past because they exercised their way through it.
Yeah, no, I think you're really, word of mouth is really important. We're working on the national level with some of your national associations, see what we can do to stimulate their interest in not only cancer, but also other chronic diseases. So, in your practice as a trainer, setting cancer aside for a minute, if you've got other folks with rheumatoid arthritis, diabetes, heart disease that are benefiting from working with you?
Mm-hmm. Oh, absolutely. And the coming off medications, that's a big thing. You
There
know,
you
how many
go.
medications can we drop? Even Judy, for example, 78, she's on a CPAP, having sleep problems. She's lost some weight and is going to talk to the doctor about not needing the CPAP anymore because she can breathe and doesn't need it. So there's a ton, a lot out there. Weight loss, of course, is probably the number one reason why you're exercising. But overall, yeah, bringing down type 2 diabetes, getting cholesterol levels down so you don't have to be on your statins. And if you can drop a couple medications, I'm not only does it help you feel better, it hits you in the wallet in a positive way because now
Yep.
you're not paying for prescriptions.
Yep. What about improving quality of life in general? Have you seen that occur with your patients that you're working with?
Absolutely. It's a confidence that they have.
Uh,
In fact, back to Judy, she went to her rheumatoid arthritis doctor and she didn't think anything of it. She just stood up from the chair without needing, there was no arms in the chair without needing assistance. She just stood up and they looked at her as like, wow, that's amazing that you did that without any help. And she didn't think about it. She just stood up
yep.
and she said, well, I mean, yeah, I exercise with my guy twice
Yep.
a week. I go to her house and
There you go.
she's loving it.
Yep. There you go. Well, Matt, yeah, I just want to congratulate you for everything that you're doing. You're a real inspiration to me and obviously to the clients that you work with. Do you have any sort of final thoughts that we could be sharing with our audience as we wrap up?
I think it's important to obviously, if we don't want to get cancer, right? What's our lifestyle now? Let's look at our lifestyle now. So, how can we prevent and not just diagnose after it's too late? And that does just go into the simple things like lifestyle. What are we eating? Are we eating 5 servings a day of fresh fruits and vegetables? Are we getting 150 minutes per week of moderate to vigorous physical activity with 2 days per week of that being muscle and bone strengthening activities? And this is what the CDC puts out there. It's been in the 2018 and the 2008 physical activity readiness paper that they've done. So it's not groundbreaking in a sense with, oh my gosh, what's out there? What do we have to do? There's a lot of room to do it in, but these are just the minimum standards. And if we can just hit the minimum standards, I mean, you've changed your life if you add zero.
Yep. And you've just hit another topic, which is the prevention of cancer. We know that approximately 40% of cancers are preventable, and of which a lifestyle is the major contributing factor. Sedentary lifestyles, obesity, eating highly processed foods, not enough fiber. You just nailed it all. Well, I want to wrap this up by really encouraging you to keep going forward. You're clearly a leader. You're what I call an early adopter. If you know Simon Sinek's work, where you start with why, he talks then about creating that small circle of early adopters, and you are one of them. And as you keep going forward, having more and more clients and patients coming to you, being active in your industry, you're going to not only attract more attention, but you're going to be a continuous leader in making all this go forward. So I want to really take this opportunity to thank Matt Peale. It's been a real honor and privilege, Matt, to be with you today.
Thank you, Jay. Appreciate that.